Hi, my name is Alexa, and I'm a security compliance consultant at MedCurity. After the country was placed under a state of national emergency in early 2020, the privacy and security restrictions surrounding HIPAA changed in order to help the medical community gain information more easily on those with COVID-19. Despite public misconception, HIPAA is and has always been in place throughout the entire pandemic. In March 2020, the Office of Civil Rights published a document entitled HIPAA and COVID-19 Bulletin, Limited Waiver of HIPAA Sanctions and Penalties During a Declared Emergency, which goes into specific detail on how HIPAA was affected by the national health emergency. This document explained what aspects of HIPAA were still in place and which rules were lessened in order to help fight the virus. Now, the real question is, with COVID-19 still raging in 2021, what is considered a HIPAA breach? With 178 breach reports to the OCR since the beginning of the lockdown and HIPAA violation fines being higher than ever in 2020, it's pretty obvious that HIPAA hasn't been shelved. Before we answer the question of what a HIPAA breach is during a pandemic, let's go back to the basic definition of a breach. A HIPAA breach is a violation that results in the improper use or disclosure of protected health information, otherwise known as PHI. If a violation did not involve PHI in any way, then it's not a HIPAA breach. However, if you are unsure as to whether PHI was involved, you have to assume that it was, just to be safe. Breaches must be placed in one of these three categories: unintentional, accidental, or intentional disclosure. Each form of disclosure has a penalty, but can be more or less severe depending on the category. For example, an intentional disclosure would have a more severe penalty than an accidental one. However, an accidental disclosure is still a breach, so it could result in a fine even though it wasn't purposeful. Around 85% of breaches are the result of hacking or IT incidents. Some examples would include ransomware, phishing, email name spoofing, hacking, malware, and much more. Other common breaches include theft, loss, and incorrect disposal of PHI. However, it's important to note that the rising use of technology has led to more cybersecurity attacks, making it a crucial aspect to protect within your organization. There are a lot of different ways that an organization could breach HIPAA, so I'll just give you a few common scenarios. Sharing PHI to unauthorized people, even if it's a professional colleague, a family member of the patient, or the media. Viewing PHI when you shouldn't, especially with COVID. It may be tempting to check on the status of a friend or see who is or isn't vaccinated, but that information is private and is not for you to see. Not properly disposing of PHI. Throwing away computer hard drives instead of destroying them or not shredding documents are just a couple of examples. Not encrypting PHI. It's required to encrypt PHI that is in transit, and it's recommended to encrypt PHI that is safe in storage to protect it from ransomware attacks. Now that we understand what a HIPAA breach is, let's go back to the question I asked at the beginning. What is considered a HIPAA breach in 2021? As I mentioned earlier, the OCR published a document in March 2020 outlining all the changes that COVID-19 made to HIPAA. This document explained the certain aspects of HIPAA that would be temporarily waived to help fight COVID-19. Some of these exceptions included allowing contact tracing, contacting family members or individuals with COVID-19, and allowing video conferencing tools like FaceTime and Zoom to now be used for telemedicine purposes. That said, the same threats to security that organizations faced in 2020 still exist in 2021. Most HIPAA breaches in 2020 were the result of cybersecurity attacks or non-compliance with the right of access requirements. So to give a direct answer to the question I asked at the beginning, a breach in 2021 is the same as any breach in previous years. Although relaxations have occurred in 2021, I want to stress that they only have to do with COVID-19 issues and have nothing to do with relaxing your technical, administrative, or physical safeguards. It is still critical and required for you to conduct a security risk analysis and ensure that your organization is protecting patient information. If you're confused about any of the regulatory changes COVID-19 made to HIPAA, or you want to make sure your compliance plan is airtight for 2021, feel free to contact us here at MedCurity. We'd love to walk you through your security and compliance strategy for 2021. As always, thank you for watching and stay tuned till next time.